Health, Home, and Lifestyle. Presented by Paradise Fitness Center, changing lives since 1996.
Hafide, and welcome to the Health, Home, and Lifestyle edition of KUAM News Extra. I'm Isa Baza, so glad you could join us. Coming up in tonight's show, we introduced you to body combat instructor Ann Martinez, who's going to give us her top 8 moves for body combat and give us all the details on an upcoming body combat marathon happening on Liberation Day. But first, here's this week's Health Check report with Joan Uggin-Charfris.
Health Check is presented by Island Cancer Center.
On Monday, the Non-Communicable Disease Consortium, along with the World Health Organization, kicked off a 3-day workshop. Taking part in these workshops were island residents and city members, a wide range of government agencies, Department of Health employees, and more.
We're having a 3-day workshop on ProLead, which is building strategic health communication skills, advocacy skills, and especially leadership skills and health promotion skills to tackle the non-communicable disease crisis in the islands.
According to Dr. Tara Kesaram, Technical Officer for Non-Communicable Diseases and Health Promotion of the World Health Organization Regional Office in Manila, this is the first time they have held such training on island.
This ProLead has been going for a number of years now, but this is our first time, I believe, in Guam, and we're joined by our other participants from FSM, from CNMI, and from Palau as well.
Dr. Kesaram says that the Pacific Islands are facing a crisis of non-communicable diseases.
Our people are dying far too soon from diseases that are preventable due to 4 common risk factors: tobacco, alcohol, poor diet, and physical inactivity. And what we're trying to do here is build capacity with our communities and working with the NCD Consortium and our healthcare workforce for them to take the lead to implement effective interventions to reduce that burden of NCDs such as diabetes, heart disease, stroke, and cancers.
She says one of the key methods they use during these trainings is the 4 sight tools,
which enable participants to look into the future to see where they want to be about 15 or 5 years, 10 years down the road, and to work backwards and identify what actions they can take now and what partners they need to engage with to implement interventions to reduce the burden, such as strengthening tobacco control legislation or alcohol legislation, raising awareness about physical activity and its importance, and helping change, for example, the food environment, making sure there are more fruits and vegetables available for people to consume.
what she hopes they take away from the workshops.
Reorientate the workforce, especially in healthcare, to tackle NCDs and provide continuous care for patients. We need all sectors to come together because health is created in the places where people live, work, grow, and play. So it's about working with education, working with health, working with the legislature, working with finance, working with agriculture, because health is created by the social determinants of health, and everyone and anyone has a responsibility for improving our health and promoting our health.
With this week's Health Check Report, I'm Joan Uggin-Charfris.
Health Check is presented by Island Cancer Center.
Thanks, Joan. Well, stay tuned after the break. We'll begin our countdown for the top 8 body combat moves. We're back after this.